cleansing the skin. Okay, so we apply eye protection to the patient and the provider and anyone else in the room. Then apply aloe vera gel. This cools the skin and allows the handpiece to glide on the skin. And what we're doing today is a BBL, or a broadband light treatment. The term that has been coined for this procedure is Forever Young BBL, because we now have science that shows that 2 to 4 of these treatments per year slow down skin aging. So what do I mean by that? As the skin ages and gets exposed to environmental insults like UV, pollutants, our diet, the RNA and DNA in the skin that makes collagen and elastin starts to break down. And by applying light in selected wavelengths, we're actually stimulating the RNA and the DNA to have those elastin factories start up again. So we actually start developing elastin and collagen in the skin as a result of the treatments. I like to blow cool air on the skin while I do the procedure because it's more comfortable for the patient. So what I'm doing first is a spot check. So I'm checking my standards and my settings to make sure that they're safe and they're going to be effective. How was that? Fine? Okay. So we see a nice pink color, so that's a good setting. And then I proceed. So the first filter I use is actually looking for any browns in her skin. Let's see, be absorbed into the brown pigment. We'll heat it up, cause a little bit of injury, and then the body goes in and starts to clean up the mess. So what typically happens, she doesn't have a lot of pigmentation in the skin, at least not on her face. So she should not have a lot of speckling up that happens with some people who have a lot of sun damage. So I'm applying this little adapter here, so that makes my treatment window smaller. And it allows me to treat the forehead and around the nose and upper lip. So the other terms that have been used for this treatment is intense pulse light treatments, or photofacials, or IPL. We call it a BBL because the company has trademarked that term for this particular laser. And photofacial is actually a trademark procedure invented by a Dr. Bittner in California. So I'm actually doing a photofacial procedure. Having been taught by Dr. Bittner personally. I'm allowed to use that term. Put your tongue under your upper lip. This This wavelength also helps to kill some of the bacteria that causes acne. So patients who have a little bit of acne will find that after a BBL, their skin doesn't break out as much for a couple of days. So now, I don't like wrinkles, so what I'm doing is I'm treating close to the eye. To get some of the UV damage that happens under the eyebrow as well. Downtime with this procedure. Patients who have a lot of pigmentation will develop, the pigmented areas will get darker for about 7 to 10 days, and then they start looking like somebody ground pepper all over their faces, and gradually that peppered up appearance fades as every time they cleanse the skin. Okay, so this was the filter for brown. Now I'm going to record how many pulses I treated her with, and then I'm going to switch the filter. Okay, so now I've changed out my filter to a filter that looks for red more than brown. Ask the question, I can still see that bright light, doctor, are you harming my eyes? And the answer is no. The light is quite bright, and even, I have special glasses doing the procedure that actually blinks every time the light is flashed. That's how bright it is. But I would have to pry open the eyes and shine it right into the eye, and I would still only damage the cornea. But it is quite bright, and a lot of times people will jump as a result. I've had patients comment that they think it's sort of strange that I'm using light to treat damage caused by light. And that's actually true, but what we're using is the wavelengths that's available in sunlight that's got healing properties. It's ultraviolet light that causes the issue. So with the exception of people who have aloe vera allergies, I do like to use aloe as my gel instead of just ultrasound gel, because it does calm the redness as we go along. So what we do now is we apply a nice cool cloth to the skin. So you can see she's a little pink. She might have a little bit, if you turn your head to the side, a little speckling here that was a little bit of the brown pigment. But she's had a few peels, so there's not a lot of pigmentation left. So our post-BBL protocol is to use C+ serum. This has vitamin C, vitamin E, and ferulic. Ferulic is an iron compound that brightens the skin. Vitamin C and E actually protect the skin against UV damage. Following that, we're applying a UV protection. This particular product has niacinamide in it, which decreases redness, and it has zinc oxide, which is a metallic UV block. This is the vitamin C serum. So we normally recommend this for 3 to 5 days after a BBL. No retinols or glycolic acid or anything that irritates the skin for 3 to 5 days. And then they can go back to their regular post-care. For someone who has a lot of pigmentation, we usually recommend a hydrofacial 2 weeks after their BBL to help take off any of the remaining speckling. And also to help with hydration, and because it's also a peel involved, it's just another treatment that's done to facilitate and speed up the healing process and the anti-aging process. There we go. She's all set, ready to go back to work. Woo! Yay!